And welcome back. Yesterday, the Supreme Court of the United States handed down a historic verdict on President Obama's health care reform. It was upheld in court, and with us this morning to break it all down is Mr. Will Hughes with the health care attorney. Good morning, sir. Thank you so much for joining us. And earlier, we were touching on exactly what this means for Americans. Can you just recap for the folks just tuning in what exactly this means?
Okay. Well, the Affordable Care Act, the Obamacare as it's called, is what it means is fundamentally health care is going to change in the country. Everyone's going to be obligated under the federal law now to purchase insurance, either have it through your employer or go out and buy it. If you don't buy it, if you're above a certain income threshold, if you do not purchase health care insurance, I believe in 2014, you're going to have to pay a penalty. You're going to pay a penalty to the IRS. That was really the central issue that was before the Supreme Court of the United States.
So those of us who have the insurance already, how will it affect us, like the people that already have insurance?
Well, in the short term, probably we're not going to see a major change. In the long term, you could see a lot of permutations in the insurance markets for health insurance. So,
but basically the bottom line here is that hopefully everyone will have medical attention if they do need it.
Well,
that's where the debate gets a little interesting.
That's where the debate gets very dicey. Everyone has an opportunity, and hospitals are obligated to see everybody that comes to the emergency room.
Right.
The policy debate in Washington is that we want everyone to have primary care coverage across the spectrum. And that's where, again, it gets dicey. You have a political issue between, I guess, the Democrat, Republican, conservative, whether you call it progressive or liberal view, and how you pay for that.
You know, many viewers have been weighing in on the issue. They have questions as well, as many of us do, and Dario Sumaya is one of them. He says, how will this affect low-income households, for instance, those who are on CHIP or on Lone Star?
Well, now the Medicaid expansion provision of the Affordable Care Act was struck down. But the entire statute was not struck down, and so it's really going to be, as the Supreme Court said, up to the states to implement the Medicaid portion of the Affordable Care Act.
Okay, sounds good. A lot more to get to. Please stick around with us. We'll be right back.